Hello everyone, this is Sandeep Sharma here. I'm in this video, I'll be talking about pediatrics as a branch. Lot of you have got good ranks and many of you are in your final year or internship and are interested in taking up pediatrics. In MBBS, we get a very limited exposure to pediatrics as a branch. So what are the pros, cons and how your life would be if you take up this branch? So that all the obvious question, why take pediatrics? See, pediatrics is a very delicate branch. I call it as delicate because you're dealing with kids here. It is a profession which works at three levels. You're not only managing and curing the disease, you're also allaying the anxiety of the parents, plus you're bringing a smile on the face of young kids. And you're getting paid for this. So the satisfaction levels in pediatrics are very high. Now you need to understand, if you ask a first year resident in pediatrics, DNB or MD, he would never be satisfied. Because residents in MD or DNB, they're never satisfied. That is the truth. You ask a AIMS resident, you ask a private medical college resident, none of them would be satisfied with their current state of life. It's the overall picture once you finish your residency, that's what I'm talking about. So the satisfaction levels in pediatrics are really good because you're doing your work and you get satisfied that you are curing a child of his disease. Second point about this branch is that it is a relative end branch. I'm using the word relative. See, there are some branches which are absolute end branches like dermatology or orthopedics in which there are no DM or MCH available. Yes, there are fellowships, people do fellowships in them, but the post-graduation degree is the final frontier in one sense. Pediatrics, there are DMs available, but whether you want to go in for DM or not is a individual decision, which I'll come to later. If you take up MD medicine or if you try to go into MS general surgery, you would know that doing DM or MCH is kind of mandatory if you intend to practice and settle in a big city. In a small city, still the post-graduation degree is enough in those branches. In MD pediatrics, whether to go in for DM or not is a relative decision, which you can always take depending upon your interest and your career goals. Third is that if you want to do DM or fellowships, a lot of options are available these days. And fourth, it is the easiest branch for doing private practice. If you compare it with radiology, surgery or setups, you don't need a setup. All you need is a stethoscope, a pen, a degree and a place to sit. And you can start your practice like that. Of course, it will take some months, some years for practice to pick up, but the initial investments are the least among any branch you'll be getting. So these are the general things about pediatrics. Second question, what are the options you have after you complete your MD? So you can join as senior resident and go on to become a faculty in a medical college. Secondly, you can go in for private practice. Thirdly, you can join a corporate hospital. Fourthly, you can go in for DM. Fifth, you can go in for fellowships. There are fellowships in India. There are fellowships abroad. Most of the fellowships are easily available in pediatrics. You can go in for government jobs, you can go in for UPSC, you can join armed forces, they offer very good packages in case you are interested, and you can do PhD or medical genetics. There is a DM medical genetics of 2 years in Sanjay Gandhi PGI for which only MD pediatric residents are eligible. Of course, the eligibility criteria is now being relaxed and you can go into research into genetics as well. And as of today, in certain institutes, if you have done MD pediatrics, you are also eligible to sit for DM adult cardiology, endocrinology, neurology, etc. What rules will be there 3 years later, we cannot predict. But as of now, if you have done your MD pediatrics, you can even change your stream partially. Like one of my juniors, immediate juniors in PGI, passing out after completing his MD, he was kind of, okay, I don't like kids, I want to change my branch. For 6 months, he prepared for DM adult cardiology, and just last month, he finished his, a couple of months back, he finished his DM in adult cardiology. He's currently practicing in Bangalore. In the day, he has his OPD practice in MD. In the evening, he also sees the adult DM patients, and on the weekends, he also does his cath procedures. So that is a life he has been living. That was a risky decision he took, but what it shows is, after MD Pediatrics, you have a lot of options, lots of flexibilities, which is not there in many other branches. Then many of you, question number 3, what are the mental blocks A lot of people want to take pediatrics, but they don't take it because they have mental blocks. I have never touched a kid. How would I put a cannula? How would I put a catheter inside a kid? He would cry. I'm a soft-hearted person. See, it's all about skills. Slowly you learn. With learning, with patience, you learn all the skills. First 2 to 3 months in residency are tricky, they are difficult, but once you overcome your mental barriers, it is a cakewalk afterwards. There was a time you did not learn how to swim. There was a time you did not know what renin-angiotensin system is, but today you know it. So similarly, once you will touch a kid, initially once you will be feeling problem in putting a catheter, second time you will put, third time, fourth time onwards, it will be like a piece of cakewalk for you. So once you are thrown into water, you learn how to swim. Dubne koi nahi dega, nobody will let you drown, so don't worry about it. But it is something which is just a mental block. Once you join residency, in a few days, in a few weeks, the mental block simply goes away. The life in residency, the fourth question, it is tough, no doubt. First 3 to 6 months, in any branch, even dermatology and radiology, it is difficult. Same holds true for pediatrics also. In central institutes and certain places, reputed places, the pressure is high. In MBBS, we are more like babies. Now you are moving into the real world. So many times people tend to go into depression. Many times people tend to start feeling frustrated. Take help at that time. Go in for counseling sessions. Hang on there. Because the first 3 to 6 months, if they pass, every day passed is one day less, and slowly you start learning, slowly you start developing the skills, and you start liking the branch. So if you ask a first year resident, most of them would say, oh, I am not satisfied with what I took. But if you ask the same question to a dermatology or an orthopedic resident also, they probably, I'm not talking about everybody, but I'm talking about in general. Most of them would say, okay, this branch has this problem and that problem. Every branch, every MD, every MS, first 3 to 6 months are tricky, and pediatrics is no exception. Just hang in there. Slowly you would start liking the branch. It is just that we don't have the proper exposure in MBBS, and so sometimes we get overwhelmed. A lot of you ask me about money. Sir, how much money would I make? See, money is important, no doubt about it, but do not run after money. If you're good in whatever you're doing, if you have the passion in your branch, money automatically flows in. Now you need to realize that it's not a branch where you would simply come out of MD or come out of medical college and start earning in lakhs. Earnings in pediatrics increases slowly. Post MD, the starting salaries in corporate hospitals is in the range of 1 to 1.5 lakh per month. Certain places it's less, certain places it's more. This I'm talking about the North India. And 3 years later, if you are still working in a corporate hospital, most of your earnings are between 2 to 3.5 lakh per month. If you are a fellowship guy, if you are a DM guy, obviously you can add 1.5 lakh more into your take-home salary. And if you're doing private practice, of course, that is a totally different ballgame together. You have to realize that it is not a procedure-based branch, and so your earnings will increase slowly, but they will never plateau like it happens in other branches. So trust me, 5 years after MD, bhukhe nahi hoge. You will have money, you will have money to buy a house, a car, and you will have enough resources at your end. In case you want to earn a bit more, you will have the avenues for that. So, but do not think that you will come out of MD and somebody will be ready with a package of 1 crore per annum for you. That is not going to happen. So it will take some time for the earnings to kick in. Life as a pediatrician post MD, a lot of you ask again. So post MD, you can decide how busy you want it to be. If you move into pediatric critical care or you are doing night duties, then obviously you will have to get up at 12 a.m., 2 a.m., 4 a.m. If you are into private practice, you would have to sit during your office hours, and you can't be away going on a hiking or doing something, because if you don't sit and patients don't find you in private practice, they would move to another doctor. So both critical care and private practice, they have some limitations. If you have an office-based practice or a group practice, which is coming up in a big way in many bigger cities, all it comes down to is what you want to be. The flexibility in pediatrics post MD is a big pro, which many of you might not be knowing. So once you take up, I would say that there are periods of uncertainty. The pediatrics will test your patience, but when you save a kid and when you see a smiling kid and he hugs you, trust me, you would realize that it's worth all the efforts. पैसा तो आता जाता रहता है. Money will keep coming. Money, your earnings will increase. But the satisfaction you would get once you start liking your branch, once you realize that it is satisfying your inner skills, that satisfaction would be something you must look out for. And lastly, some of you have asked me that is there a thing that girls can take up or boys can take up? Whether you are a girl or a boy, you can easily take up pediatrics. In fact, in my batch when I did MD, there were three girls, and there were 12. It was a batch of 15. There were 12 boys. Last year, in the same place where I did my MD from, there were it was a 25 wala batch, out of which 15 were girls and 10 were boys. So girls usually are a bit more empathic to children, and children tend to open up to them. So don't be afraid that you're a girl, you can't take up pediatrics. Whether you're a girl or a boy, if you have the patience, if you have the skills, if you are willing to connect to the kids, willing to put up with the patients, with the parents of the patient, then it's a wonderful branch you can take. So all the best, and develop the skills, be patient. Patience is the key, learning is the key. So about MD versus DNB and what are the colleges which are better in each, that I'll be posting in the other video. So thank you. And if you join pediatrics, you're most welcome to let me know. I would love to have a small chat with my fellow junior pediatricians. All the best.